In the untamed wilderness of Australia, one creature strikes fear into the hearts of those who dare to cross its path, the red-bellied black snake, also known scientifically as Pseudicus porphyricus.
With its sleek black scales and crimson underside, this enigmatic serpent harbors a deadly secret, a venom potent enough to send shivers down the spine of even the bravest adventurer.
As we delve into the depths of its treacherous bite, prepare to uncover 6 spine-chilling facts that will leave you on the edge of your seat.
From the sinister composition of its venom to the harrowing consequences of its fangs, join us on a journey into the heart of darkness, where the line between fascination and fear blurs with every twist and turn.
1. Venom Composition. The venom of the red-bellied black snake is a complex cocktail of proteins and enzymes specifically tailored to incapacitate its prey. One of the most significant components of this venom is its neurotoxins, which target the nervous system of the victim. Neurotoxins work by interfering with the transmission of nerve signals, disrupting vital functions controlled by the nervous system. When injected into a human or animal through a snake bite, these neurotoxins can lead to a range of symptoms, including muscle weakness, numbness, and paralysis.
Once the venom enters the bloodstream, it travels rapidly throughout the body, allowing the neurotoxins to exert their effects on various organs and tissues. In the case of a red-bellied black snake bite, the venom's neurotoxins primarily target the motor neurons responsible for controlling muscle movement. As a result, victims may experience progressive paralysis, starting from the site of the bite and spreading to other parts of the body if left untreated. This paralysis can affect vital functions such as breathing, leading to respiratory failure in severe cases.
2. Fast-acting venom. The venom of the red-bellied black snake is known for its rapid onset of action, often leading to swift and severe symptoms in victims following a bite. Upon envenomation, the venom's potent neurotoxins quickly enter the victim's bloodstream, where they begin to exert their effects on the nervous system. This rapid dissemination of venom throughout the body contributes to the swift onset of symptoms, which can manifest within minutes to hours after the bite occurs.
One of the most alarming consequences of red-bellied black snake envenomation is respiratory distress, which can occur rapidly and progress to life-threatening respiratory failure if left untreated. The neurotoxins in the venom interfere with the function of the muscles involved in breathing, leading to weakness and paralysis of the respiratory muscles. As a result, victims may experience difficulty breathing, shortness of breath, or even complete respiratory arrest, necessitating immediate medical intervention to support breathing and oxygenation.
In addition to respiratory distress, red-bellied black snake venom can also cause muscle weakness and paralysis in other parts of the body. The neurotoxins target motor neurons responsible for controlling muscle movement, leading to a loss of strength and coordination in affected muscles. This muscle weakness can impair mobility and coordination, making it difficult for victims to move or perform basic tasks. In severe cases, the paralysis may progress rapidly, potentially leading to complete immobilization and loss of function in affected limbs or body regions. 3. Aggressive behavior. While red-bellied black snakes are typically shy and reclusive creatures, preferring to avoid confrontations with humans and other animals, they may exhibit defensive behavior if they feel threatened or cornered.
Like many snakes, red-bellied black snakes have evolved defensive mechanisms to protect themselves from perceived threats, and they may resort to striking if they perceive a potential danger. When confronted with a perceived threat, such as an approaching human or pet, a red-bellied black snake may adopt a defensive posture, including coiling its body and raising its head in preparation to strike.
While their first instinct is usually to flee and escape the perceived threat, if they feel trapped or unable to retreat, they may resort to defensive measures, including biting as a last resort to defend themselves.
This defensive behavior can pose a risk to humans and pets, especially in encounters where there is a potential for accidental or intentional provocation. For example, stepping too close to a hiding snake, attempting to handle or capture a snake, or accidentally stumbling upon a snake's hiding place can trigger defensive responses and increase the likelihood of a bite.
To minimize the risk of encounters with red-bellied black snakes, and reduce the likelihood of defensive behavior. It's essential to take precautions when exploring snake-prone areas, such as wearing appropriate footwear and staying on designated paths or trails.
Additionally, learning to recognize the signs of a snake's presence, such as rustling in the underbrush or the sight of a coiled snake, can help individuals avoid unintentional encounters and give snakes the space they need to retreat safely. Overall, while red-bellied black snakes are not inherently aggressive creatures, understanding their behavior and respecting their space is crucial in mitigating the risk of defensive encounters and reducing the likelihood of snake bites in human-snake interactions.
4. Difficulty identifying symptoms is another terrifying fact about this snake. Unlike some other venomous snake species, whose bites may result in immediate and obvious symptoms, such as intense pain or swelling, the initial effects of a red-bellied black snake bite can be relatively subtle and non-specific, making it challenging for victims to recognize the seriousness of the situation.
In many cases, the initial symptoms of a red-bellied black snake bite may include localized pain, swelling, and redness around the site of the bite, which can easily be mistaken for a non-venomous snake bite or other minor injury. These symptoms may develop gradually over time, further complicating the identification of envenomation and delaying the initiation of appropriate medical treatment. Moreover, the onset of more serious systemic symptoms, such as respiratory distress or muscle weakness, may not occur until later stages following the bite, further complicating the early identification of envenomation.
This delay in symptom onset and progression can hinder victims' ability to recognize the seriousness of the situation and seek prompt medical attention, potentially leading to delays in treatment and increased risk of complications.
To address these challenges, it's essential for individuals living or working in snake-prone areas to be aware of the potential risks associated with snake bites and to seek medical attention immediately if bitten, regardless of the severity of initial symptoms.
Educating the public about the signs and symptoms of snake envenomation, as well as promoting awareness of the importance of early medical intervention, can help reduce the likelihood of delays in treatment and improve outcomes for individuals affected by red-bellied black snake bites. 5. Potential for fatalities. Despite the rarity of fatalities from red-bellied black snake bites, untreated bites have the potential to lead to severe complications and, in some cases, death, particularly in vulnerable populations such as children or individuals with pre-existing health conditions.
While red-bellied black snakes are not among the most venomous snakes in Australia, their venom still contains potent neurotoxins that can cause significant harm if left untreated. In severe cases of envenomation, the neurotoxic effects of red-bellied black snake venom can lead to respiratory failure, a life-threatening complication that occurs when the respiratory muscles become paralyzed, preventing adequate breathing and oxygenation.
Without prompt medical intervention, respiratory failure can quickly progress to respiratory arrest, resulting in death if not addressed promptly with supportive measures such as assisted ventilation and administration of antivenom. Children and individuals with pre-existing health conditions may be at increased risk of complications from red-bellied black snake bites due to factors such as smaller body size, reduced respiratory reserve, or compromised immune function.
Children, in particular, may be more likely to suffer severe envenomation or develop complications due to their smaller size and higher metabolic rate, which can lead to faster absorption and spread of venom throughout the body.
Furthermore, delays in seeking medical attention or inadequate treatment of red-bellied black snake bites can exacerbate the risk of complications and increase the likelihood of adverse outcomes, including death. Prompt administration of antivenom, along with supportive care measures such as respiratory support and monitoring for complications, is essential in mitigating the potential risks associated with red-bellied black snake envenomation and improving the chances of a favorable outcome, particularly in vulnerable populations. 6. Type and cost of the antivenom. One commonly used polyvalent antivenom in Australia is the Australian snake antivenom, which is produced by immunizing horses with small, non-lethal doses of venom from multiple snake species and then collecting and purify the antibodies produced by the horses in response to the venom. These antibodies are then processed into Antivenom, which is administered to snakebite victims to neutralize the toxic effects of snake venom and prevent further harm.
The Antivenom covers a range of snake species found in Australia, including elapids such as red-bellied black snakes, as well as other venomous snakes like brown snakes, tiger snakes, and taipans.
Polyvalent antivenoms are designed to neutralize the venom of multiple snake species, making them versatile and effective treatments for envenomation caused by a variety of snakes.
The cost of Antivenom can vary depending on factors such as the brand, formulation, and healthcare system in which it is administered. In Australia, where red-bellied black snakes are native, Antivenom is typically subsidized or provided free of charge through the public healthcare system, ensuring access to life-saving treatment for snakebite victims.
However, in other countries where access to healthcare may be more limited or where specific antivenoms are not readily available, the cost of Antivenom can be a significant barrier to treatment for some individuals.
Like any medication, Antivenom can potentially cause side effects in some patients, although adverse reactions are relatively rare. Common side effects of Antivenom may include allergic reactions such as itching, rash, or hives, as well as more severe reactions such as anaphylaxis in rare cases.
To mitigate the risk of adverse reactions, Antivenom is typically administered under close medical supervision in a hospital or clinical setting, where trained healthcare professionals can monitor patients for any signs of adverse effects and provide appropriate treatment if necessary.
In addition to polyvalent Antivenom, some alternative treatments may be used in certain situations, particularly in regions where specific antivenoms are not available or in cases of severe allergic reactions to traditional Antivenom. These alternative treatments may include supportive care measures, such as airway management, fluid resuscitation, and pain management, as well as experimental therapies such as enzyme inhibitors or novel Antivenom formulations. However, the efficacy and safety of alternative treatments for snake envenomation may vary, and their use should be guided by healthcare professionals familiar with the specific circumstances of each case.
Overall, while Antivenom remains the primary treatment for red-bellied black snake envenomation and other snake bites, it is essential to consider factors such as cost, availability, side effects, and alternative treatments when managing snakebite cases, particularly in regions where access to healthcare may be limited or where specific antivenoms are not readily available. Thanks for watching.